most of the time the presentations are born after my one-on-ones with people. So if you want to speak, call me and ask me to do a one-on-one with you. But this time I met this gentleman a while ago, and I kind of knew what he was doing, and he approached me and he said, you know, it's been a while since this group heard about this topic, and March 1st is the deadline. So let's bring the information again and open the floor for a Q&A. So Dan is actually one of our very loyal member. He has been coming to this group for quite some time, you know, very generous. He contributed a few times, some gifts for the drawing as well. And Dan is going to talk to you about the Obamacare. It's a program that allows small business owners to have an affordable health benefit, and Dan is going to answer most of your questions. He has about 20 minutes, so please help me invite Dan to the floor. He has a very long last name, so I'm not going to really try.
Well, my last name is Pin Schmidt, which is Schmidt, put a pin in front of it. So it's not pinch anything. But what I'm going to talk about is Obamacare, do the who, what, why, where, and where. A lot of people don't know a lot of the facts about it. Pardon me? Obama doesn't even know. Not going to get a political side. What is Obamacare? What is Covered California? What is the Affordable Care Act? They're all the same thing. The difference between a state exchange and a federal exchange, the exchange is the actual part of Obamacare that matches up the companies with the people. Kind of like a dating service. And what it does is it takes your needs and it matches it to the company that provides it, whether it be Kaiser Blue Cross, Aetna, Anthem, whoever it is. And once you're married up to that person, then you pay the company directly. It doesn't go through Obamacare or Affordable Care Act or Covered California. Now, the reason why there's a state exchange versus a federal exchange is many years ago, back in 2010, they said, okay, all states can be under the federal exchange, or we will give you money and you develop your own exchange in that state. California is one of the few states that said, yes, I want to develop my own exchange. That's why the people that have been doing things in California have not had all the problems that the federal exchange has had, because we're not part of the federal exchange. We have our own thing going because we have a little bit going on with technology in the state. So we were able to put it together ourselves. I'm going to go over some facts and figures. So I did not develop a lot of slide presentation and everything, so get out your pens and pencils if you want to copy down some things. The goal originally for Obamacare was to get people off of emergency care who didn't have doctors. And as you know, well preventative care is cheaper than emergency care when it's too late. So that would drive down the cost, which would be advantageous. The second goal of the plan was to have all of the companies on an equal footing with the same type of policies, which would create competition and again, hopefully drive down the cost. Who does this affect? There are two groups. There's people, individual people, and then there are what's called SHOP, which are companies that are in three different levels. It's under 50 employees, from 50 to 99, and then 100 or more. Those are the three levels of SHOP. That's a coined phrase that they have. It's called SHOP. Who's eligible? The people who are eligible must provide proof of citizenship or legal entrance into the United States. So the things that you hear about that illegal aliens are coming in and getting coverage, no. What is the difference between the plans? Well, the plans that are available, there are variables in all the plans, and they go depending on the number of doctor visits that you have, the number of prescriptions that you have, the lab tests that you need, usually on a yearly basis, the hospital stays, MRIs, C scans, deductibles, co-pays, and monthly premiums. So those are all balanced out for how it's going to be charged versus what your needs are versus what the company provides. So what I'm trying to do is I'm trying to take thousands of pages of Obamacare and put it into one sheet. So there are some things I'm going to go over briefly, but not actually all the specifics because I'd be up here for another 3 months. Now these plans are divided into 4 groups. There's a bronze, a silver, a gold, and a platinum. Obviously, if you have a bronze program, it's going to be less monthly cost, but it'll be a higher cost when something does happen. Your co-pays will be higher. You'll have to pay more for your prescriptions, and you may have a higher deductible. But at least your monthly payments are less. That's good for a young kid in college that doesn't go to the doctor, doesn't have prescriptions, doesn't do anything, and they can still get the coverage that they would need, but not have to pay the monthlies, or they may have to pay a higher for visits. If you do not have health coverage, or you need to change because you got a message or a note from your coverage that says that they're no longer going to provide it, you must be enrolled by March 31st or face a fine. The fines for 2014 is $95 per adult or 1% of the household income. Children in the house are half of that price. For 2015, the fee is $325 per person who is not enrolled in something, or 2% of the household income. Children are half of that. 2016, it's $695 per adult in the household that's not covered. Children are half price. So a husband and wife, 2 kids that aren't enrolled by 2016, that's $2,100 penalty that will come off of your taxes, or be added to your taxes. Who to contact? The people that you contact at Covered California would either be counselors, navigators, or agents. The counselors and the navigators are not licensed, which means they're not bonded, and they may not even be certified, they're just trained. So, when you do need questions answered and you do need to enroll in something, bypass the counselors, bypass the navigators, and go to the agents that are bonded, certified, and licensed. Now the other part of Obamacare, or Covered California, is the business owners. This is the shop part. I've briefly gone over the individual, now I'm going to go to the shop. The final regulations were changed as of the 10th, Monday. So here's the changes that they made to shop. Businesses with fewer than 50 full-time employees, and nationwide that's 31 million, are not required to provide coverage, but could qualify for federal subsidies if they do provide coverage. So people businesses under 50, you're on your own individually if they choose not to. Businesses with between 50 and 100 employees. This is the big change that they made, but this is only 7.9 million nationwide versus the other, which is 31 million. They do not have to start offering coverage. They were extended another year. They don't have to start offering this coverage until 2016. For the larger group, which would be 100 or more employees, this is about 74 million employees. The final rules have reduced to 70% the number of full-time employees to whom the employer is enrolling. And then in 2016, you must have 95% of your people enrolled. So that's what changed, is the big group, they lowered it by 15% for the first year. Now some of the rules have changed as far as how they identified government volunteer people like let me see, firefighters, emergency responders, people who work on a volunteer basis. They are not going to be considered full-time employees, but school teachers who work 9 months out of the year and have the summer off, they will be considered full-time employees. That was left, it was out of the books and no one knew how they were going to be classified. That's basically in a nutshell what's been going on with Covered California, Affordable Care Act, and Obamacare. Do you have any questions? I told you this is going to be brief. This is just an update. Yes?
So on the fines, you know, the however much or a percentage of the income, is that with the tag whichever is greater?
Yes. It's whatever's greater.
Figured, but
And are those, presumably, I mean, are people notified of the fines or demand payment, or how do they work that?
The actual logistics of how it's going to work, I'm not 100% sure, but if you're not enrolled in some kind, it'll show up on a line item on your tax form for that year. Those tax forms haven't even been printed yet, but there will be an item that says if you do have health insurance, who do you have? If you don't, add this to your tax liability.
If anybody wants to ask a question, we can use this.
Sure.
What's the question? You
Oh,
tell me.
the question was, so the rest of them can hear, was what?
Oh, was,
Forget.
This started with me at about 40, you know.
oh, how will they be notified?
How will they be notified? Yeah, and that's how I answered the question.
I assume that at certain income levels, the care is free. Do you have any idea where those cutoffs are? What families do pay for it, which don't?
Yes, it is figured on your gross household income. It does have different levels. If you are making over 400% of the poverty level, you will not get any assistance. Under, it goes all the way down to 0. If you have no income, then you will be able to sign up for Medi-Cal, and it'll be provided for you. If you want something off of the Medi-Cal, then you'll get a percentage off. There are people that they're supposed to be paying about $700 a month that are only paying $150. It depends on your income level and how many people are in the family. And I don't know if that's going to change or not. It probably won't, but it's, again, this is not to go over every little point, but yes, you can go anywhere from 0 to 0% covered to no coverage at all. I think the upper limit is, Doris, do you remember what the upper limit is?
94,000.
94,000, husband and wife, 2 kids. If you make over 94,000, you no longer get assistance.
It's like 43, according to the commercial, it's like 43,000 or something.
Yeah, for an individual, it's around 40,000. But it's a percentage of the national poverty level.
If you do qualify for assistance, is it taxable? That assistance, is that considered income?
Good question. Did you remember, Doris?
Credit.
Credits, tax credits. Yes? Oh, we're going to get somebody else. Sorry.
Dan, do they have to go to the website to do it? Can you go, because I have a client that he went on the website and he went through the whole process of applying, and then he got to the point that says, please upload your proof of insurance. I said, well, I don't have insurance, that's why I'm on the site. And so he could never get past that. He made the phone call, and the phone call says, we're experiencing high call volume, please call back later.
When you do go on the website, they will say, do you want to try and do it yourself? Or do you want somebody to help you? Or you just want to go straight to an agent? If you click on go straight to an agent, there's a list of certified agents that have gone through all the training. They're certified, bonded, and they have what's called an E&O, which is errors and omission insurance. So if they screw up, they're completely covered. Then you have a list of those people by address, and there's a picture next to them and a little bio on them, so you can choose. You click on it, and they will give you a call back, and you'll deal directly with that person that'll walk you through it. You can go to their office, they'll come to you, or you can just do it over the phone if you want. Or you can try to do it at an agency where you go into a government office or you go into a private office. It just depends on what you're more comfortable with.
There's also a paper application on that website.
Yes. But if you have a problem going through the application process, Obamacare for Dummies, and that, no offense, but if you do have difficulties doing something like that, that is out there and they will walk you through everything or come out and do it for you. But there's no cost to having it done. So the agent that comes out, there's no cost that you have to pay them, and if that happens and they say, oh, you owe me, no, but they won't. Go on.
Does ACA have any coverage for dental or visual?
Yes, they do. And that
Is it an optional or is it also included?
optional. That's something that you can get.
I've been concerned about the level of medical identity theft in the last few years and increasing. Has there been any statistics that this will possibly reduce the amount of medical identity theft?
ACA and NSA are like that.
Beg your pardon?
I said, of course, ACA and NSA are like that.
I don't know who those people are.
I'm really not going to get into the speculation or the political aspect of the Affordable Care Act.
I just want to know when the deadline is for this year, and if you don't make the deadline, when will be open enrollment again?
Okay, the enrollment for the first year, which was this year, started in October, November, December, and they extended it for 3 more months, being that it is the first year. So you get January, February, March 31st. When you do enroll between March 1st and March 15th, you will have the coverage April 1st. So it takes a minimum of 2 weeks. So if your policy is going off the books April 1st, you better get in before the 15th. If you want to do something by the 15th, you got to get in by the 31st.
So, but if you miss this period, what would it be next year?
October.
Next October.
Now, that's if you don't have anything change. If you have a birth, if you move out of the state, or you're just coming into the state, or you change jobs, something has changed, then you can do enrollment. But for the people that are here and nothing has changed and they were just lazy, you have to wait. Oh, the other change to that is there is no deadlines for Alaskan Eskimos or American Indians, who are a first or second generation tribe. They can come and go anytime they want.
What about those who have are on a group insurance through a company? Do they have to sign up anyway?
No, if you're already on a group insurance, this doesn't affect you. Only if you're on a group insurance that has sent you a notification that they're canceling your policy. If they're canceling your coverage, it's because you did not meet, or the coverage that you did have did not meet the minimum federal guideline. And so that part is being dropped. Guideline of what they think is the minimum coverage you should have. Very similar to, right now you cannot buy a new car that does not have seat belts, airbag, or catalytic converter. The federal government says the new cars have to have that. If you want a new car, it's got to have these features. Did these features cost more on the car? Yes, but they had to have them on the car to meet minimum federal standards. Same with California Care and Obamacare. It has minimum standards built into it, and that's why the coverage is the way it is.
But Dan, when you buy a new car, those features are protected.
Right, right, exactly. That's why these minimum standards for your health coverage are put in place, because they're minimum standards.
So you described how the subsidies work for individuals or families, the credits are based on the property line. You indicated they also have some kind of a credit program for small businesses. Can you characterize that, or is it?
Yes, there are tax advantages for small business to offer it. There are tax credits, and businesses that are going to be involved in that You do, as a business owner,